Hey, Margie here. Today we're diving into something that's often overlooked in conversations about osteoporosis, and that's inflammation. So, in today's episode, you'll learn number one, what is the relationship between chronic inflammation and bone loss? Number two, what testing can be done and what are the symptoms? How would we know if we have chronic inflammation? And number three, what can be done? And I'm really excited about our special guest, Dr. Ann Shippy. And Dr. Ann is a board certified internal medicine physician and certified functional medicine practitioner. I absolutely love her root cause approach and how she looks at inflammation when it comes to working with patients with bone loss, as well as so many other health conditions. And you can learn more about all her great work in the show notes. But this episode is full of so much great information, so stay tuned. Welcome, Dr. Ann. I'm so happy to have you here on the podcast. This topic is extremely important and something just not always appreciated. So I'm just really happy that you're joining me today to shed some light on this. So thank you.
Oh, I've been looking forward to this so much.
Before we get into inflammation and how this can affect our bones, you want to just share a little bit about how you got into this area and how you got into functional medicine. I always love to hear the backstory.
Well, I took a very indirect route to what I do now, and I'm actually like it's a dream come true to get to do what I do now. I was a chemical engineer working for IBM for almost 10 years. Loved it, got to do amazing things like get some of the chemicals out of the manufacturing process that are really bad for the environment. And I thought I was going to be a long-term IBM employee because I really loved it. But I went on vacation and I got super sick and came back and nobody could help me. I went from doctor to doctor to doctor. I got so skinny that people thought I had cancer, and I had to figure out what was going on with my body myself. It took about 8 or 9 months of trying all kinds of different things, changing my diet, going to a nutritionist, a naturopath, getting acupuncture. I saw this very out of the box thinking immunologist, and I was able to put together a program that completely healed my body. And it got me so fascinated with how the human body works that I woke up in the middle of the night one night and decided I was changing careers and going to medical school so that I could do medicine differently. Because I really wish that I had had somebody to guide me along the way. And so I was very fortunate to get to do that at that point in my career. And and then about the time that I was finishing med school and residency, I got sick again a couple years later. Had gone into standard internal medicine because I had 2 little kids when I was done with it, and I just needed to focus on them. And I developed a couple autoimmune disorders that didn't have any good answers in the allopathic model, and that's when functional medicine was on the map. So I got the additional training that I needed to really fulfill my dream of getting to do medicine differently. And really, by reversing my own autoimmune diseases, I could hold that space for patients that they would be able to reverse their autoimmune situations.
Oh, I love that. And it's so crazy how, things happen and then we can pay it forward and help so many others when we've actually gone through it ourselves. Wow, what an interesting story, but how wonderful that you ended up doing what you do because it's gonna, I know you've helped so many people. Wow.
Yeah, and there really so many silver and platinum linings in the struggle, right? The fear, am I ever gonna be well? Am I gonna be able to have, the energy and the resources to be able to care for my family and my patients and all those things? I now know so much about my body and how it works that I can that I can put those things into place on a regular basis and be super healthy.
Yeah, I love that. We experienced that with my husband. He's a physician as well. He had his own autoimmune issue and he learned so much that he's been able to help patients as well. So, but
Amazing.
yeah, no, it's just something that people don't appreciate how much is involved. And when you look at things through the lens of functional medicine, it really opens up a whole new path of healing that's often overlooked. And on that note, let's talk about osteoporosis because
Well, and that's
yeah,
such a great example, right? Because we have so many ways we can measure what's going on with the bones and see how they're doing and see them heal, right?
exactly. And so when we look through the functional lens and we understand the role of inflammation in bone loss, why don't you just share a little about why we need to uncover this, inflammation, if that's existing, because how is that really affecting our bone loss? And, why don't we just start with that?
So I think of inflammation as just a very complex way to get a lens into what's going on with the immune system. So, so many symptoms that we have are conditions. I won't call osteoporosis even a disease. It's just a condition, right? It's
So
just,
I
hey,
call it that too. I never call it a disease. I hate that word. Yeah.
right. So, I think pretty much every time that I've found that somebody has some bone loss, whether it's osteopenia or osteoporosis, we can put our finger on some type of inflammation in the body. So, is there a food allergy? Is there a disruption with the mitochondria? Is there a low-grade chronic infection somewhere in the body? And or is there autoimmunity? There's so many different things that we can look at to just answer what type of inflammation is going on and then help us to get to the root cause of it. And so often the bones are kind of an innocent bystander, I think, right? Because when the body is dealing with inflammation, it's got so much extra work to do. So it can be diverting the resources in the body towards solving whatever that problem is and even pulling from the bones to try to to quench the fire that the inflammation is causing.
Yeah, so true. Are there any telltale signs, for people listening? I know there's lots of testing that can be done, but are there
Mhm.
any signs when you're talking to a patient that you're like, that would maybe indicate that someone has chronic inflammation?
Such a great question. So some people, I think there's been kind of like a slow dialing up of the inflammation. And so they're like the frogs in the pot. So, if you put a frog in the boiling water, it'll jump out. But if you gradually heat up the water, it'll stay in and boil. So some people have kind of had that gradual heat up. So they might just think, oh, this is aging. Like this is just normal. And unfortunately, I think a lot of times when people go to the doctor, they're just told that that's part of the normal part of aging, but usually there's something that people are noticing. They're either, a little bit more achy or a little more stiff in their body. They might be having some skin rashes. They might be feeling more tired. It can be very nonspecific. It doesn't have to be an obvious thing or just chronic rashes. So things like eczema and psoriasis that a lot of people have are can be that thermometer for the inflammation. It can just be mood or, some people just when their bodies are super inflamed just feel more anxious or more depressed because it's actually their brains are the more sensitive place. So a lot of times I think about the inflammation as kind of it finds the thermometer wherever the weakest spot is in your body. So for me, it would be things like skin and joints. Those are going to be the first place that I can notice the twinge of the inflammation kicking in, or with one of the things for me with solving the original health crises was that I had undiagnosed celiac disease. So I think about gluten sensitivity and celiac as being a spectrum of disease. And because until I went on that vacation and picked up the parasite, which really dialed up those genes that cause the celiac, I was managing okay. I might feel stress in my gut a little bit more, but I was absorbing just fine. But then when that tipped me over, it really ramped up that scale of inflammation.
Hey, Margie here. As a physical therapist, I know firsthand how important exercise is for our bones, overall health, and happiness. And unfortunately, there's a lot of confusion on what exercises are safe and effective for people with osteoporosis. That's why I created this handout. That contains a 30-minute video where I explain the concepts so you understand the do's and don'ts when it comes to exercise. And this is important because this way you can go into any class and know what you should be doing and what you should avoid. Because too many people are doing exercises that actually increase their risk of spinal fractures. I also included videos of me demonstrating effective balance, posture, and weight-bearing exercises you can put into your day right away. So all you need to do to access this handout, it's free, is go to tinyurl.com/osteoporosis exercises. So it's tinyurl.com, again, /osteoporosis exercises, or you can click the link in the show notes. Now back to the show.
Wow. And the sad thing is some of the things that you talked about, joint pain and, skin irritation, a lot of times they're treated with over-the-counter or antibiotics or some type of cream that's just touching the surface. It's just calming the symptoms, but not really delving into the inflammation and the root causes. And
Exactly,
so
because unfortunately, most doctors don't know how to look for the root causes of what's going on. So they've got the Band-Aids in their toolboxes, which we need sometimes. We need those Band-Aids, but I think we're a lot of times doing people a disservice if we don't do that root cause analysis. And so even things like headaches or migraines, a lot of times those are just band-aided and they're really significant warning signs that there's something that is gnawing at the immune system and having to make it work harder.
that's so true. And the gluten and celiac, but also just gluten sensitivity is a huge. I've seen that in my, working over 30 years with people with bone loss, such a big issue. And that was my husband's issue as well. That was overlooked, and it really had such an impact on bone health as well as overall health. But it's something that in this population is just
It's so yeah. So, a lot of people really don't wanna make those dietary changes because it's inconvenient, it could be more expensive, it makes it more of a hassle to travel, to feed your family, and all of those things, but I'll go out on a limb, and I will say that I think that doing a gluten-free diet is lowers inflammation for pretty much everybody to some extent, but for a lot of people, a significant extent. So it really is one of the sources of inflammation that I like to check for. There's a company called Vibrant Laboratory that does the best screening that I've seen for the wheat issues. So all the gluten issues, because they look at so many different chemical structures of the wheat molecule that it's less likely to miss it. So that's just I'm sensitive to that because that was part of my story with the celiac is the original testing that my doctors did to look at whether that was an underlying cause, missed it. It wasn't that they didn't check for it. It was just that the tests weren't sensitive enough to pick it up for me.
Yeah, that wheat Zoomer is the one I recommend as well that does pick up. And oftentimes for some people, the blood work will pick it up in terms if they have the antibodies. But as you said, it's oftentimes missed. So I think that test is the most comprehensive. That's the one that Dr. Millman, so many of the doctors who work with this really found the most effective. So I
Yeah.
couldn't agree more. In terms of, well, what testing do you like then? Like where, if someone's not sure, they have bone loss and they don't know why, and they, make sense this theory. No one can figure out what's going on. And, they want to do a root cause. What are your favorite tests that you found to really signal that they do have this inflammation?
Yeah. So, just as baseline, where are you? I think the DEXA scan, to see where they are. But unfortunately, doing that test much more than once a year doesn't it. If you check it in 6 months, it doesn't tell you. It's not accurate enough. Are you heading in the right direction? So, do those around whether insurance covers it or not, try to do it once a year, but in between times, I'll check whatever I can get, and it kinda changes over the years what labs are available for looking for some of the bone resorption markers.
Yeah, so I think that's absolutely essential. Yep.
So I'll use that test to see if I'm in the right direction or not between the bone densities. And then we'll try to make sure that the body's getting the nutrients that it needs to build healthy bone. So are you we can check nutrient status. So something like a NutriVal through Genova Diagnostics. So, are you getting enough protein? Are you getting enough minerals? Is your body detoxifying? A little bit about the mitochondria. So, that's one of my favorite panels to do to get an overview along with the vitamin D. And then also just looking for root cause analysis, right? So, is there an issue with the parathyroid? Are there issues with how the body's regulating protein? So, protein electrophoresis to look for some of the more disease states are a couple of the things that I would do. And then even a cholesterol panel. When we do the advanced lipid testing can be a way that sometimes we can get information that would look for some sources of inflammation that might be covered by insurance. So there are a few, because I think about cholesterol as just being part of the body's regulation to handle some of that inflammatory damage. So there's high sensitivity CRP, an LPPLA2, an MPO, and sometimes a fibrinogen is helpful for looking for types of inflammation that are going to be more likely to be covered by insurance. There's some other specialty things that may or may not be as part of that NutriVal. We have something called an 8-hydroxy-2-deoxyguanosine, which is a marker for DNA damage, and a lipid peroxidase, which is a marker for whether the mitochondria are able to keep up with that fire from the inflammation. So the more data that I can have to make sure that we're on the right path and measure our progress is great. And then one of the next things I would do would be to look at what's going on with the digestive system. So many people have issues with their gut and they may not have any symptoms at all, that there's inflammation going on there. So, and of course, that's where 60 to 70% of our immune system is. It's where we are absorbing our nutrients to build our bones. And it's so much of how the chemical messaging is happening in the body. And it's really challenging these days to have a healthy microbiome because of all the environmental pollutants that are coming in from the food packaging, the pesticides, all the different things that we're getting exposed to. So even just a shift in the bacteria can cause the inflammation to be occurring. But I also see like just a lot of low grade chronic infections, whether it's fungal, certain bacteria that I think about as being, they're normal to have there, but they can be kind of pesky when they get to overgrow. And then there's a lot more parasites than what we traditionally think are present. And so if we can identify those, then the body doesn't have to work so hard um, from an inflammation standpoint to try to keep things in check.
That's so true. In terms of the gut, oftentimes when we do these tests that really show you what's the composition of the microbiome, you can address it more effectively. And for some reason, that's just, I don't know why that test isn't something that every conventional doctor or even GI looks at. Do you have any idea why? That always perplexes me.
Well, it's not taught in medical school and it's outside the insurance model a lot of times. So to use this DNA technology to really identify what's going on with the microbiome, most people either are taking it into their own hands and going directly to the laboratory companies or finding a functional medicine doctor to help them because it's just not what we're trained to do.
And from your practice, what have you seen when you do address this? Has it made a huge difference?
It makes a huge difference, in just so many areas of the body to, get digestion optimized and to get the microbiome optimized. You know, I think about it even on an epigenetic level. So how our genes are getting expressed in our bodies. We gotta play well with the organisms that actually run our body. We have, I think it's like 100 times more DNA of the organisms than our own. So they're so integrally important for us to be collaborating well with, and it doesn't take much to throw that microbiome off. I mean, huge run-ins with something super stressful happening. I know you talked about some of the family stresses that you've gone through. Those can really shift what's going on with the microbiome. Um, a lot of us deal with some carb and sugar addiction at different times in our life that can really, really throw things off. And then it can be challenging to get it back on track without actually having some data to know how we're doing.
I know that's the beauty of working with a functional medicine doctor who's going to really help you with these tests and figure out what's the strategy and what can be done because there's so much that can be done. And, sometimes it's like a crapshoot. Oh, let's do this, let's do that, let's do this probiotic or that one. But yet, when you see what's going on, are there parasites? Are there what's going on? What's the composition? We can be very specific and really be effective in how we deal with the microbiome. So I think it's just so important. And
You're making me think of one of my older patients. So I'm so lucky because sometimes I get to work with multiple generations in the same family. So I'd helped the young adult son, and then he brought his mom, and then the mom brought the grandmother, and she's 85, and she's having trouble with her bones, and she's her flexibility, like she wasn't able to get down on the floor to pick things up anymore. She was feeling like she was not able to focus and concentrate, and or even have the energy to go do the things that she wanted to do with her family or her friends. And so we did, this is the work we did. We looked at her microbiome. She had some gluten and dairy issues. She had a little bit of environmental toxins that she wasn't detoxifying very well. And we can come back to that. But the last time she was in my office, she had her brain back on. She was able to win at bridge again. Her bones were looking better. Her gut was feeling amazing. And the thing that was like, okay, this has really, even though like at 85, you're like, can we even get better at 85? We were leaving my office to go have her check out, walking together, and I dropped something. She bent over and picked it up more quickly than I could even get to it. So it's like, when we can even dramatically improve health for patients in our mid 80s, and to see it in the things like the bone density improve and then her actual function of her body, both, it's just so heartwarming.
it really is. And that's why I get so upset when people are like, oh, it's just old age. And that so many people think they have to live with this when they just don't realize what's possible. And I think sometimes what I have found is a diagnosis of osteoporosis is really scary for people. And it's often the catalyst for them to start making changes and find out what's going on. And when they do, and let's say they, see someone like you and their inflammation reduces and all of a sudden their brain is clear. And as you said, their joints, it's just so wonderful. And it's possible. It's not something that we're just making up. That's to me what's so exciting when you do this kind of work because you see these things. I love that story, and that's fun.
Well,
Yeah.
and I love that you're doing such a great job of bringing hope and giving people tools to know what to do and where to start looking, and then to really listen to their intuition that they can improve and they can get better and not just take a medication.
It's true because when I started this podcast, I knew functional medicine doctors and I knew what was going on. I'm like, the world has to know this because there is another way and there are things that can really help that just aren't out there. I think things are getting better now. It's becoming, more accepted. And even in traditional, conventional medicine, they're seeing this integrative approach to a smaller extent, but it is getting out there, which I really like. And so when you see someone, what's your order? How do you, I mean, there's so many things. We're just
Mm.
going through basic, but like what's your order when you see someone, in terms of what you adjust?
Well, I'm so lucky because I've got this kind of engineering brain. And then I really get to spend time with my patients. So when we meet, usually the first visit is an hour and a half or 2 hours. And so I get every piece of information that they think is relevant from their past and present and get to very much fine tune it for them. But I'll tell you, I think the most important thing for all of my patients is really making sure that they have a good foundation laid, which if we think about the body is made up of nutrients. And we a lot of times we and it runs our biochemistry. And a lot of times when we're eating, we're just doing it for the fuel, right? We just need the calories. We need to be able to run our day. And so if I can get with this initial visit, if I can get people to start thinking about what they're putting into their body as the building blocks for their bones, and further healing, that's where I love to start. So, we really look deeply at what they have been eating and what they can start to eat that will make a difference. And then what nutrients does it take to build bone? And then one of the things that I found super, 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 super important in the last year or two, especially as we're in this GLP-1 world, which I think probably everybody in your audience knows what those are so far, but the injections that make people lose weight, but then also lose muscle, is I've really been emphasizing the importance of muscle to have healthy bones as well. So I really find that for most people, it's over 100 grams of protein in a day, which is no light feat, but the goal of a gram per pound of body weight, most days, and then some supplements that also really help with muscle. So things like creatine, and there's a peptide combination that I get through Healthgevity called Longevity, and then a supplement called Myos, which is corticotropin. That combination, plus using your muscles in whatever exercise you're willing to do, can make such a huge difference with the bone marker turnovers, and then ultimately lead to better bone density. So if I can do that bit of education and negotiation, because it is a lot of work, right? To get the dietary things dialed in and then to prioritize resources to the spending money and time on getting the supplements into the body. But I can't overestimate how important some of those just foundational things for everything else we do with looking for sources of inflammation, the food allergies, the grade infections, the toxins, as the big groups. It it makes everything else more effective in our efforts.
I love that you're looking at all pieces and the muscle part. That's so important. That's something that I think is just essential, and people don't realize how powerful that is, both in terms of making sure you have the building blocks, but also in terms of actually doing what exercise you can do. And I love that you've seen that and you incorporate that into everything you do.
Some of the biohacking kind of thing is just like, it's kind of nice to have, right? Like if you can get in an infrared sauna, hyperbaric, PMF mats, um, all of these things, I think they do have like icing on the cake beneficial things, but all of these things, depending on, what you're really drawn to, works so much better when you've got strong bones, strong muscles. It's so good for your brain. It's so good for your heart. So good for your immune system. Like all the pieces of your body really benefit from prioritizing that work.
It's so true, and that's when people, I think, oftentimes come back and say, "No, this was a blessing in disguise," because they were a couch potato before, and this diagnosis was the one that said, "All right, I know now I have to exercise," but then they get sort of into it because they see they're powerful and, there's just so many benefits with their muscles, and they don't wanna give it up, and they look back like, "Oh, I'm so glad I did this." So, 2 things I have for you. What about homocysteine? Do you measure that? What's your thought on homocysteine?
Yeah, so this is an area that I love to delve into, the whole methylation patterns, because it really is an important part of how we can do repair, how we can detoxify our bodies. So many of the messages chemical messaging in the body is dependent, as well as our epigenetics, so how our genes are being dialed up and dialed down. So my favorite thing to do is to do a panel where we look at some of the genes that determine how well you're gonna methylate. There's a bunch of companies doing that now. And then to do kind of an advanced methylation panel that has homocysteine, SAM-SAW, cysteine, glutathione, and several other things in it. So we can really look at that whole methylation homocysteine pathway. And then what's so beautiful about it in this area of nutrigenomics, how the nutrients that we're putting in our body can influence our physiology, is that we can make amazing impact in the physiology in the body, and I think do not just correct imbalances going on now, but we can dramatically change the trajectory of our health. And in this, we haven't mentioned it yet, but this area that I'm so fascinated with, the preconception, like what men and women can do before they get pregnant to have healthy babies. This is such an important part of knowing how your body is operating so that you can have better hormone balance, better fertility, and potentially impact the health of your future child by having your methylation pathways work really well. This whole field of epigenetics getting passed on from the egg and the sperm and potentially improving your child's future health is just so exciting. And kind of a little segue on that is, I think a lot of times men don't get osteoporosis screened for or diagnosed until they have a major issue. At least with women, we're a little bit better about doing some screening with bone densities, but I now screen men for bone density over 50 and sometimes earlier if we find that they've had some fairly significant inflammation or gut issues. So I think just for those of you listening, just know that this is a male issue too, and we can really help to do the prevention for the men as well. And then kind of back on the fertility conversation and muscle, it turns out that men that really prioritize having good muscles, like really working out and being strong, also improve their fertility.
Yeah, I wanna delve into this in a minute because I think, a lot of us, if it doesn't affect us, if we're a little older than that, we have children, and this is truly an epidemic right now. Too many people are having fertility issues, and they're not looking at the functional medicine viewpoint. So we're gonna get into that in a minute because I'm very excited about that because I know someone here will have a grandchild or a child, who is having issues, and I think your work is amazing. So hold on that for just a few minutes. What panel though? Is it regular blood work you can get from Quest and LabCorp for this panel on the methylation, or is there a special panel that you like people to get?
So we can they're specialty panels. They're not super expensive. I think they're right around $200. And, people can always try submitting them to insurance, but I don't count on it. So Doctors Data and Genova Diagnostics are the two that I use the most often. The homocysteine alone, you can usually get through insurance, but to do the more advanced testing, especially if you suspect that you might have a methylation issue, it's definitely worthwhile to do the panels through the advanced testing.
Oh, okay, great. So before we get into the fertility, for people listening, they're like, "Oh my gosh, I want to see you." Can you just explain? They're listening, thinking, "Oh gosh, I need this kind of testing," and they don't know really where to go. Can you just explain how you can see people? Because I know you work with people one-on-one. So I think just tell people how they can see you and then just explain that.
Oh, thanks for asking. I'm in Austin, Texas. So anybody who's kind of in the vicinity, it's pretty easy. They can have a lot of patients in Dallas or Houston, but I also have quite a few patients that are outside the state. So the requirement in Texas is that I see people the first time in person, and then after that we can do remote for the rest of the follow-up. So I love getting to have that first appointment in person, but then once we have a relationship established, I think we can do really well remotely.
Well, the nice thing is Austin's an amazing place.
It's a great place
It's
to
not
visit.
like you're going to Nowheresville for this. They could have a little vacation too. Okay. So anyway, the point is there's so much, I mean, I think you shed so much light on there's so much this integrative approach can do with bone and looking at inflammation and targeting it and then taking care of that. Is there anything more before we discuss this fertility that you want to share with people? Or what would you say were the top things maybe for everybody listening in terms of the inflammation piece?
Yeah, I think the big thing is, um, if you think about your bones and this potential for inflammation really driving bone loss, the things that help you help your bones are gonna help the rest of you as well. Like, you will have the healthier brain, you will have the healthier heart. Everything in your body's gonna work better when you solve the bone issue. So, in a way, it's a fairly wonderful, thermometer or, check engine light, to use to really improve the entire health of your body. So, at times it can feel a little daunting, a little overwhelming, and, maybe you don't get it figured out right away. It takes a few, rounds of investigating and, using the testing to see where you are, a few bone densities before you see the one that you actually see the bone density increase, but it's so worth the effort to put it into, really your health longevity so that you can be like my 85-year-old patient who's able to get down on the floor and and take care, do things and still be such an active member of her family.
Yeah, I love that. There was this one class in New Jersey, we have these different exercise classes that for bones and things, and I'll go in and they're moving chairs and different things, and they're in their 80s, you know? It's, like, so amazing when people stay active and all and healthy with all the things they do and uncovering the root causes,
Yeah.
etcetera. And
So
so
if you start in your 30s, 40s, 50s, it really can truly change the trajectory for your health, and it doesn't have to look like a decline. Like, there is hope to feel good for, um, most or all of your life, and then when it's time to check out, you just go and, um, and not have to suffer.
okay, so we're gonna change tune a little bit, and because I see this all the time, I just cannot believe how many people are, having fertility issues and, luckily there is IVF and there are all these amazing things, but, there's an underlying sometimes root cause that might be missed. So why don't you, because well, tell everybody about your book and what
Mhm.
you've seen, because I think this is really, really important. And unfortunately, it's not out there to the extent that it should be out there.
Yeah, unfortunately, we have quite a confluence of issues coming together. It's now 1 in 6 couples are dealing with some type of infertility, so that means that they've been trying for a year and not getting pregnant. It's
One
generally
in
a
6 now,
50-50.
that's what it is? 1 in 6?
Mhm, and probably very soon 1 in 5, like, it's escalating. It's 50-50. So 50% male, 50% female, and often both couples can be involved. But the thing that I'm really alarmed about is this children's health crisis. It's 1 in 31 children are being diagnosed with autism, the increase in cancer, autoimmunity, diabetes. Like, our children are very sick. And so my message is this preconception period, so the 3, 6, 12, 24, 36 months before and between pregnancies is untapped possibility for how to get your body so that you're fertile and that the epigenetics, if we think about the sperm and the egg as being like little time capsules for the baby to know, for their genetics to know how to operate, it will help them to be healthier in the long run. So that's what my book, The Preconception Revolution, is about. It's a little hefty, but it's the things that you can be doing in that period and how you can test and know where you are. Because the narrative's pretty scary. I'm talking to these 28 and 30-year-old women that aren't ready to start their families yet. And they're being told they need to be saving for IVF because if they don't do it now, they're not going to be fertile. And that is not what I see. My oldest patient right now is 47, and she was so smart. She was like she, had a gap and, um, and met the love of her life, has 2 older children, and they really wanted to have a child together. She'd heard about me. She came, and we found some things, some inflammation and some things we needed to work on. She did her work for 3 months. She was supposed to come back and recheck a couple of things, but they had one night where they were like, "Oh, let's have fun," not thinking that they were gonna get pregnant on the first try. And so now she's, 6 weeks away from delivery, has had an amazing pregnancy. She feels great. Baby, everything looks, incredible. She'll be 48 when the baby's born, and so that just changes the conversation. I have so many women that, especially when both partners come and do this fine tuning or do what's in the book, that they get pregnant even while they're nursing their previous baby, or because they get so fertile, or they start doing this process and what the methodology that they were using for birth control, the rhythm method or the pull-out method don't work anymore. So I want people to tap into this preconception period to optimize their health. And some of the people that are most interested in this topic are the grandparents to be, because they
Yeah,
want their
that's my crew
grandbabies.
here. These are grandparents, yeah.
Yeah,
'Cause you
they
feel
want
badly if you're hearing the struggles, it's the most stressful thing in the whole world when people are trying, and then the stress piece interferes with everything. So what are some of the things then? Like, give us some examples of things in your
Mhm.
book that you found really move the needle. Like, what type
Yeah,
of things? Yeah.
um, unfortunately, it's the environmental toxins. So we are just getting bombarded these days between the toxins in our air, our food, down to things like mattresses and carpets and things in the environment. And our bodies just are not able to keep up with helping to detoxify at the rate that they're coming in. So a lot of what I want people to do in this period, whether they're able to check their levels or not, is to help their bodies to detoxify. So if you think about it, some people are like, "Oh, wait, I don't wanna have a baby for a year or 2." This is the perfect time. Like, if you're 3 months away from wanting to conceive, you gotta really get on it and work hard, to make a dent in things, but for these, 28-year-olds that aren't sure exactly when it's all gonna be the right time, start, now, because these environmental toxins not only affect fertility, it's part of what that check engine light is when the body's saying, "Wait, it's not a good time to have a baby right now." So, figuring out where those toxins are coming from and helping the body to get them out in a very scientific, helpful way rather than some of the things that are out there on the internet about, the juice fast or this cleanse or that cleanse, just a very thoughtful, safe way to detoxify and get the toxins out.
And that's all in your book. What about testing? Is there testing you recommend for people that really do think they have an issue and wanna see, do they have heavy metals? Is there a certain testing that you like? Is there
Yeah. I really like Great Plains, environmental testing or Vibrant to know where they are. The heavy metal testing is a little bit more tricky because to really know where you are, you have to take a chelating agent, and that usually requires a prescription, but you can get a pretty good idea from the Great Plains Tox Screen or the Vibrant, and then I've also launched an online program that makes all the testing accessible for participants in the program. They can access the things that I think are important through that, and then also get coaching around what action to take and what to do as the labs come back. So that is
like,
on
what is
my.
the program? Why don't you just
Mhm.
share a little more
It's,
about this
yeah,
program?
thanks for asking. It's the everybabywell .com program. You can access it both through the Shippy MD site and the Every Baby Well, but, it's easier to find on the Every Baby Well 'cause, that's really the mission here is reduce the suffering that families are going through by dealing with the infertility and the unhealthy children. It's so hard for families these days, so I'm just really loving working with these couples to in a more of a volume than what I can do with my one-on-one with the patients. It's just really encouraging how inspired they are to make these changes, to work together and encourage each other. I'm just amazed at what a difference it makes to be able to have these conversations and get questions answered and really understand what this period what a difference it can make.
Oh, I love that. And so this is from all over. Anybody can take this course. You don't have to look.
Yes, I've got one in Canada and one in Finland even. So
Mhm.
it's really kind of amazing how this message is going global. These couples are finding this, they hear me on a podcast or a TV segment or something, and they're like, wait, there's stuff I can be doing now. Especially the men. They're so like they get so inspired about knowing that what they're doing before conception can impact the health of their future child and maybe even future generations. They get so engaged and committed to implementing these
The
changes.
truth is, typically the men don't get involved until there's a problem. You know what I mean? The woman's seeing the OBGYN, they're figuring everything out, and then, oh, let's look at the sperm or whatever. But as you said, this whole preconception, if the man's eating the worst diet in the world and having issues, and it all impacts this baby, so and the fertility. So I think that's something that's really not looked at until way down the road. And why even get there if they can early on get everything under control? Like, I love the idea of preconception, that year getting yourself in best physical shape so that it just makes things, it makes so much sense, but yet it's not something that everybody has a preconception visit, which they should,
They should. I really like the data is so compelling.
Ah,
Like the research that's gotten done is absolutely incredible. I am in awe of the researchers looking at these things like the difference that glyphosate and PFAS make, the difference between, men who exercise and the ones that aren't as far as the sperm quality. Is the blood sugar controlled? What are the stress levels? Like so many of these factors that are modifiable make such a huge difference for the future baby and even the pregnancy. So the healthier the father is with all of these things, the less likely there is going to be a placenta issue or preterm labor, um, hypertension in the mom, like all of these things we're finding, and it makes perfect sense, right? The healthier the mom, the healthier the dad, the healthier the baby. You just know it when you hear it, but then when there's data to really back it up, I think that's what really inspires the day-to-day choices.
ah, I love this. So for everybody, anyone having any issues, or even before they're having issues, if I think this is such a good way to go. And how funny, I'm sitting here thinking the exact same things, the toxins, the blood sugar, all the things that affect the bones, so you can work together with your child. It could be a dual or even with, it's all the same. It's just applied in different ways. And I think that's so amazing that you were able to work with people with osteoporosis and also now this new generation use that same knowledge. So I'll have all the information on the book in the show notes. Is there anything else? This has been so helpful, and it's always so wonderful to me to hear all your successes and how this approach is helping so many people. And I just love getting this out there. Plus, you're seeing patients. So for anybody in Texas or just want to make that they can see you and get all this done, because people always ask. It's very hard to find. So this is all really, really exciting. Anything else you want to share?
Well, just thank you for I know it you just feel compelled to get good information out and to really help people to know how their bodies work and what they can be doing to do the real prevention and the reversal of these things and to really believe in their bodies and to trust their bodies again.
Oh, absolutely. Well, it's just been a pleasure. And thank you so much for joining me. This has been
Thank you so much.
information. I hope you enjoyed my interview with Dr. Ann as much as I did. And now the better understanding of how we can use functional medicine and look at inflammation and address it as a way to improve our bones, overall health, and even our fertility. All the links that Dr. Ann talked about will be in the show notes, including the link to her practice where she works with people one on one. Number two, she has programs for people with fertility as well as her book, The Preconception Revolution. And I think that's so exciting that you can work with people before they conceive, and that can really make a difference and really help avoid all the frustration that accompanies fertility. So if you do know people or have children who are dealing with this, I really think this is just a great resource to pass on to them. So all of that will be in the show notes. And the other thing that Dr. Ann talked about that I love is that for the fertility couples, when she has this program, there's a community. I'm such a big believer in community because I feel we can all strengthen each other when we work together. And that's why I have a membership as well. So I only charge $29 a month, and it includes question and answer. We have a monthly class with a guest expert, as well as my happiness class, which helps reduce stress and increase happiness. So if you're interested in that, that link will also be in the show notes. So thank you so much for tuning in. I look forward to seeing you on the next episode.